Hi there, my name is Katherine Morton and I'm consultant psychiatrist working in NHS Lanarkshire. So I have the privilege of working in both a eating disorder service and a perinatal mental health service. And so I was delighted to do this particular section on eating disorders during pregnancy and the perinatal period. And it's worth just noting that Selena Gledoware, consultant psychiatrist, also inputted into this section of the guidance. So I'd like to acknowledge her really helpful contributions. So to start with, we had got two key questions. Key question 17 was what are the most effective interventions to support pregnant women who have an eating disorder? And we had a number of interventions that we thought we would be looking at, and also a number of outcomes that we thought that we'd be looking at. Our second key question was, what are the most effective postnatal interventions to support new mothers who have an eating disorder? And again, we had a number of interventions that we hope to look at, and then a number of outcomes that we hope to kind of assess the response by. Unfortunately, when we did the search of the literature, we found very little research on any specific interventions in pregnancy and the postnatal period for patients with eating disorders. What we did find, though, was that we found some evidence that pregnancy appears to be associated with improvements in dysfunctional eating behaviours in most women with eating disorders. But we also found that there appears to be a higher risk of relapse in the postnatal period. Qualitative research confirmed these findings and also added some really helpful context to the findings, really just helping us understand that women on the whole were balancing the needs of their baby against their eating disorder whilst they were pregnant, and thus they tended to navigate a kind of new eating disorder during the pregnant period. It was also found that pregnancy might be an opportunity to change, but also there are barriers to women disclosing their eating disorder to professionals for a variety of reasons. We found a likely association between eating disorder symptoms and depressive and anxiety symptoms during pregnancy and postnatally. And we also found that women with an eating disorder may be more likely to have medications during pregnancy. We also discovered that women with a history of anorexia nervosa may be at increased risk of iron deficiency anemia during pregnancy. Women with eating disorders may be at higher risk of obstetric complications, and we also found that infants born to mothers with eating disorders may be at higher risk of social, emotional, eating and feeding difficulties. Qualitative research also identified that there were barriers for health professionals in terms of providing eating disorder support for women in the perinatal period, and the reasons for this included lack of evidence-based knowledge and training for professionals. So, in light of our findings, in light of the evidence, we have made some recommendations and some good practice points. I suppose this picture is a kind of diagrammatic representation of the process myself and Selena went through, just trying to kind of weigh up the balance of evidence, but also just try and think about how we could make meaningful kind of good practice points and recommendations. We are really now keen to kind of open up this process to yourselves and really look for your feedback during the consultation process, really just to kind of hone our recommendations and our good practice points based on the current evidence base. Thank you for listening.